Hello and welcome to a Balanced Body podcast. I'm Dr. Brent Anderson with Polestar Physical Therapy and Pilates. I'm a physical therapist and specialist in Pilates for rehabilitation. And I wanted to share with you just a couple modifications to the exercise to work with some very special and unique populations. One in particular is the population of patients who are going through treatment for cancer. A lot of times when they are undergoing chemotherapy, they don't tolerate being completely supine on the Pilates equipment, and yet they can still benefit from some very light exercise, particularly more of assisted exercise through ranges of motion that allow them to move their body and even improve the circulation of their body so that the treatment is more effective. The other populations that deal with this are cardiopulmonary patients. Sometimes they have a hard time laying flat as well because of a heart pathology or pulmonary pathology. And the last group that I want to share this with is anybody that has an adversity to being able to lay completely flat. For example, I have a patient right now who has a very severe kyphosis, and it's almost impossible for her to lay down flat on the table. So what we have are a couple props that I want to demonstrate with you, and the first one is the wedge. And the wedge is a very typical piece of Pilates equipment that we can place right on top of the Pilates reformer. You can also use it on top of the trapeze table and even use it on the floor for mat exercises. And it's basically a pillow to be able to provide the support needed. So I've asked Jamie just to model this for us in doing something as simple as footwork or even some single leg footwork that we'll demonstrate. So as she lays back, notice that we're able to keep her up. We also use these kind of things for women who are pregnant, especially in their third trimester, to be able to prevent from being in that supine contraindicated position. So let's have her go ahead and press out a couple times. So we can still concentrate on the disassociation stabilization at the hip and the pelvis, and we can still concentrate on her form and her breathing. We can change her foot position by having her bring her feet together. Or we can do some more things like even single leg exercises that might be a little more challenging to be able to get the abdominal work. So just leaving that leg up as she presses in and out forces her to use her abdominal muscles a little bit more. So even in the most gentle of settings, we're able to maintain some of the integrity of the exercise of Pilates and to be able to provide that positive movement experience for our clients who might otherwise not be able to enjoy the benefits of Pilates exercise. This is Brent Anderson from Polestar, bringing you another Balanced Body podcast. Look forward to seeing you in the future.